Hello, welcome to this lecture for the Chrysalis Diploma in Counselling Skills and Theory. This is component 1, Foundations of Counselling and Theory. And this is part 1, the Psychodynamic Approach. You can find the standards to be met for this component in your module notes and on Moodle. I will be sharing some slides with you during this lecture. Please make a note of any questions you might have so you can take these to class and discuss with your class tutor. Hi there, my name's Kay and I'm going to be taking you through this lecture today. For each module, it's important to watch the video and read the online notes. And then please print out the class notes and take to the session with you. In this course, you're studying the pluralistic approach, which asserts that no one model of therapy is better than any others. And so in the pluralistic approach, we use the most effective parts of different models and tools to suit our clients' needs. The main 3 approaches are humanistic, psychodynamic, and CBT. And so for this first lecture, we're going to be studying the psychodynamic approach. In the next module, you'll be looking at the person-centered approach, which is part of humanistic therapies. And in module 3, you'll be looking at CBT. So psychodynamic approach really came from Freud's psychoanalysis. And psychoanalysis was generally a long-term therapy. Sometimes people could be in therapy for years. They may attend more than 1 session a month. Often they laid on a couch and were referred to as patients. Obviously, Freud's work was many years ago, and obviously society has changed and moved on, and everything has really changed now. Actual psychoanalysis is very uncommon, and a psychodynamic approach is now the preferred model. Let's look more. Oh, why does this always get stuck? Why does it get stuck? There you go. Okay, so the main concept of the psychodynamic approach. So psychodynamic theory is determinist and it views our behavior as being unconscious. Most of our behavior is outside of our conscious control. So a lot of what we do in our day-to-day life is really operated from our unconscious. So we drive our car unconsciously. It's only maybe when we have to get into somebody else's car and drive that it becomes more in our conscious control, because we have to think about it. Our unconscious contains a host of memories, fantasies, thoughts and feelings which we find unacceptable or too threatening to be conscious. So while in our unconscious mind, there's a lot of material that we may just have forgotten about, or we don't even know we know, there's also a whole host of thoughts and feelings, often about past experiences, which we've found unacceptable or fearful. And so they've been pushed into our unconscious mind. Our early relationships are important, and problems in these relationships can create problems later on in life. So the psychodynamic approach recognizes that our early attachments and environments are really important, and that what we experience and learn in those early years can form patterns of behavior, and we can take these into our adult life. So if we've had negative or traumatic things happen to us in the past, we might repeat these patterns in our later life as well. Therapy involves clients becoming aware of their unconscious material to understand the meaning of their distress or their symptoms. So sometimes clients are aware that they've got a problem, but they don't really know where the issue stems from, because it's been pushed into the unconscious mind. And so in therapy, we're trying to make the unconscious conscious, so that the client can understand and become more self-aware of what's actually going on. We resist awareness of this material through a range of mechanisms called defense mechanisms. And we will go on to talk about that shortly. Resistance in therapy also often manifests as transference and countertransference. And again, we will talk about this in a little while. And as I said earlier, more modern psychodynamic theories have to a large extent moved away from some of the main aspects of Freud's model, such as the psychosexual stages of development and the pleasure principle, towards a more relational and social context. So the psychosexual stages of development that Freud came up with were obviously many, many years ago, and society has changed a great deal, parenting has changed, and so these psychosexual stages are not seen as relevant today. However, it's still really useful to study those psychosexual stages, because they can still have some relevance in our therapy with clients. Let's move on to look at Freud's model of the mind. So this is the Iceberg Principle, and this really means that there's only a very small portion of the content of our mind that is in our conscious awareness. So most of it is under the surface. So like the iceberg that's in the water, most of it is under the water and we're not aware of it. So your conscious awareness is very small. At the current time, what's in your conscious awareness might be that you're hearing my voice, you're listening to this lecture. You might be aware that you're sitting on a really comfortable chair, or maybe an uncomfortable chair. You may be aware of some thoughts floating through your mind, like, oh, I'm getting a bit peckish. But there's not an awful lot that's in your conscious awareness. Most of it is under the surface. Now, there's a very small portion there that you can see as well that is pre-conscious. So pre-conscious means that it's below the surface, but you can easily bring it to the surface. So it's material that is recent memories, maybe. Like if I said to you, what did you have for dinner last night? Or what was you watching on the TV last night? You'd probably be quite easily able to remember that and bring it into your conscious awareness. Now, everything else is below the surface. You can also see here the id, the ego, and the superego. And this is also often totally out of our conscious awareness. We operate from these different positions, but we're not aware of what is going on. So let's look at that in a little bit more detail. So the id. Now, the id is the real driving force behind a person's behavior. When we talk about psychodynamics, you know, psyche means mind and dynamic means energy. And Freud referred to the energy of the mind and called that libido. And the id is really where the libido sort of starts. That's where the libido energy is, and it's the driving force. And the id seeks gratification of basic human needs, and we call it the pleasure principle. The id is really the childlike part of us that wants what it wants, and it wants it now. It thinks short-term gain, often doesn't think about long-term consequences. It's the I'm going to have a tantrum if I don't get what I want. The ego seeks to maintain the individual as a complete entity. It adapts to the forces of external reality depending on the individual's needs. And it uses a variety of psychological functions, which include learning, thinking, memory, and speaking. We call it the reality principle. See, so the ego is really assessing what it needs to do, and it looks at the reality of a situation. Now, the superego has the task of balancing the demands external to the individual brought about by society in which we live. And this concept can be likened to the conscience and develops from parental guidance. We call it the perfection principle. So this is really all the shoulds and musts and shouldn'ts that we've learned from parents, but also teachers, authority figures in society. There's things we think we should do and things we think we shouldn't do because that's what we've been told. And so these are often in conflict with each other. So, for example, you could be sitting here listening to me and your id is saying, oh, this is a load of rubbish. I want to go out. I want to go and have some fun somewhere. And your superego will kick in and say, well, actually, no, because you must listen to this. You're doing this course and you need to listen to it. You need to behave as is expected on this course and watch the video like you've been told to do. The ego looks at the reality of that situation, and yes, you could go out and do something else, but then you're probably going to miss out because you'll get to class and won't know what they're talking about. So these are always in conflict, and that conflict creates anxiety, and then the anxiety leads to defense mechanisms. So let's look at those. Now, there's a lot of defense mechanisms, and I'm not going to go through all of these. There's some notes on these in the module notes, but we will look at some of them. Now, most people have got at least some of these. And it's important to try and recognize them in yourself. We also need to be able to recognize them in clients when you start working with clients. But again, it can be difficult. You might recognize some of these in friends and family members. So let's just choose a few of these to look at. So you will probably all be aware of denial. So denial is the first stage of grief. And that's because when we hear bad news, it's difficult for us to accept that and deal with it. And so the denial is like a defense mechanism. It protects us for a little while and lets us come to terms with that information in a slower, more gentle way. So denial can be useful. However, if it goes on for too long, then obviously it's a bad thing. So, for example, if we deny that we're in financial struggles and we put all our bills that we receive away in a drawer and deny that we've got them, then obviously the long-term consequences of that are not good. Displacement. And this one is when you're really maybe anxious and angry with somebody, but you take it out on somebody else. So, for example, maybe your boss has put you down in some way and it's made you angry, but you can't really say anything to the boss. So you bring that anger home and maybe you take it out on the dog or your partner. And you do that because it's easier to take it out on that person. There'll be less repercussions of that. Idealization is another one. And that's when we idealize a person. And that stops us from having to deal with the conflict of maybe the good and bad in that person. It's a way of avoiding real feelings about the person. Phobic avoidance. Those of you that have done the hypnotherapy course will be aware of phobias. And it's a way of us avoiding things that make us anxious. It shouldn't say phobic avoidance projection. Projection there should be on a different, on the point below. And projection is really about when we project stuff that's within us, our own feelings or personality traits, and we project them onto others, acting as though they are the ones with the problem. And that, again, it's a way of us avoiding dealing with our own issues. It's easier to pretend that they're somebody else's. So we project. Rationalization is another one. And that's when we rationalize something to make ourselves feel better. So, for example, we could go for a job interview. It's a job we really want, but we're not successful. And we rationalize it by saying to ourselves things like, oh, well, the journey there was awful anyway. I wouldn't want to do that every day. Or I didn't really like where the place was situated. Or the people who interviewed me didn't really seem like my type of people. So we're rationalizing why we didn't get it, making it better for ourselves. Regression. Those of you that did the hypnotherapy again will recognize this one. And this is when we regress to an earlier stage of development. And that's because that time was safer for us. we felt better then, we felt more secure, so we regress. Repression, as I mentioned earlier, if we think back to the Iceberg Principle, anything that is very uncomfortable or traumatic, we can repress. So it's gone deeply into our unconscious mind, so we're no longer aware of it. However, sometimes something might trigger us in and bring it into conscious awareness again. Not always. Some people can repress material for the whole of their lives. Sublimation is a more healthy defense mechanism, and it could be us diverting our energy into something more acceptable. So instead of getting into a fight because of our anger or anxiety, we maybe go to the gym or we go running. And so that's a healthier thing to do. But of course, we have to bear in mind that those things can become habitual and actually become negative because we do them too much. And then suppression. And suppression is similar to repression, except we are consciously trying to push things that we don't really want to think about. We're trying to push them into the unconscious mind. And sometimes it's successful and sometimes not so much. So we're trying really hard to not think about things that we don't want to think about. So these are just some of the defense mechanisms that we have. And as I say, most of us have use at least some of these. So try to recognize some of these in yourself and read about the ones that I haven't mentioned today, so you have more understanding. Let's move on to look at transference and countertransference. So recognizing transference and working with it in therapy is seen as very important in psychodynamic counselling, but it is an advanced technique and it can take time and experience to be able to identify transference in the therapy room. So transference is when a person transfers feelings about someone from their past onto another person. And countertransference is that person then reacting back to the transference. So how does that happen in the therapy room? I mean, it can happen in conversations with friends and family, but we're really interested in how to deal with it in the therapy room. So it could be that a client, say a client who had issues with their mother, maybe their mother was controlling, they didn't get on very well, and something about the therapist reminds the client of their mother. And it can be appearance or the way the therapist says something or some content that the therapist brings up, that suddenly the client is reminded of their mother and so reacts to the therapist as though they're their mother. Maybe they become hostile or angry. Now, if the therapist reacted back to that hostility and anger and maybe became defensive or angry themselves, then that would be countertransference. They're reacting back. And we also need to bear in mind that it doesn't need to be negative in that sense. It could be that the client had a very nurturing mother and misses that because maybe the mother has died. And so with the therapist that reminds them of their mother, they could act in almost a childlike way, wanting that nurturing from the therapist. But what we aim to do in the therapy room is to be able to pick up, identify the transference, and then work with it in the therapy room. So, for example, if the client who became hostile, if the therapist is very self-aware, they will recognize that suddenly the client is showing this hostility or this anger, and they will address it. So maybe saying something like, it seems that you've suddenly become a bit angry towards me, and I wonder if we could look more at that. And this helps the counsellor to understand the client and what's happening. And it also brings self-awareness to the client and helps them understand what's going on. So it's very useful. But as I say, it is an advanced technique, and it does take some time to be able to recognise this in the therapy room. So psychodynamic counselling is really about making the unconscious conscious. It's recognising the power that the past has had over us, looking at early attachments and early environments, looking at patterns that we've often followed from childhood through into adulthood, and giving the client more understanding and self-awareness so that they can make the future different to the past. And we'll be looking more at psychodynamics later on in the course. But for now, we're going to move on to look into ethics and professionalism. And let's start by looking at the foundations of the therapeutic relationship. So it's very important that therapists act professionally and ethically, following a code of ethics. And on this course, you will be a member of the National Counselling Society and follow their code of ethics. You need to know what's in that code of ethics, and it's about trying to keep a client safe and having a professional relationship with them. We create a helpful environment. So what does that really mean? That means we need to have a safe, secure, confidential, private space. And that space also needs to be comfortable for our client. We don't want a space that's cluttered. We want somewhere that's fairly neutral. Colours of nature is very helpful. And somewhere where we're not going to be disturbed. We need to make sure that we don't give our client advice or tell them what to do. We're working together with them, not acting as an expert that knows what's best. We're working collaboratively. We need to make sure that our client knows what to expect regarding confidentiality and the limits of confidentiality. So it's important that you're very clear on what that is. And we'll go on to look at this shortly in a bit more detail. We also need to be working within our own competency limits. This year, you will be working with volunteers, and you will only be able to work with issues that have been studied this year on the course. it's always very important that you only work with what you're comfortable to work with, what you're competent to deal with. So that will be limited this year. And even when you're a qualified therapist, there may be areas that you don't feel confident in and don't have enough knowledge of. So working within your own limitations is very, very important. Having regular supervision. So all qualified therapists need to be in regular supervision. And this is, again, is about working in the best possible way for the client, making sure we're keeping them safe and working professionally and ethically. And when you go into placements next year, you will be having regular supervision and be able to see the benefits of that. Also having personal therapy if needed. And personal therapy can be very useful because it's always good to see the other side of things. So what it's like to be a client coming to therapy. During this course, there may be things that are discussed that trigger you into a reaction and make you realise that things that you thought you'd dealt with actually maybe haven't been dealt with. And it's really important to go into personal therapy if you think you need it. Because we can't be good, competent therapists if we haven't worked through our own issues. It's also really important to use the core conditions and core counselling skills. And we'll go on to look at these in a bit more detail. Let's firstly look at the exceptions to confidentiality. So you will be having a contract with volunteers and with clients when you work with clients. And that contract is very important to make sure that you're working professionally and ethically. And part of that contract will be confidentiality and the exceptions to confidentiality. And they are as required by law. So if a client discloses terrorism, drug trafficking, child abuse, you are required by law to report that. And also, if you are subpoenaed to appear in court or hand over notes. And this is why your notes should be accurate and kept safely and securely. If you think there's a serious risk of harm to the client or volunteer, or that they're a risk to others. And in this case, you may need to contact a GP, hospital, or the police, especially if you think the client is going to harm someone else or that there's a risk of suicide. And supervision. Most of the information you give in supervision will be on a need-to-know basis without identifying your client. But it's always good to make your client aware that you will be sharing some information about them in your supervision. And organisational policy. So, for example, on your placement next year, there may be a level of confidentiality that extends to other professionals within the organisation and other professionals such as the GP or mental health services. So let's move on to just look at the core conditions. Now, the core conditions really come from person-centered therapy. However, in the pluralistic approach, we also view them as essential to help build our relationship with the client. It helps us to build trust and rapport with our client. And there's actually 6 core conditions, but these are the 3 that are the most important for you to think about at this current time in your training. So, empathy. This is the ability to see the world through the eyes of your clients. Imagine walking around in their shoes and what that would be like. It's trying to figure out how they experience the issue they've brought to therapy and what it feels like to be that person. So we're really trying to understand their frame of reference, what it's like to be them. And obviously that's really important for them to feel understood. Unconditional positive regard or respect, and this is about valuing your client for the unique person they are and working from the belief that all human beings are basically good and that your client has their own good reasons for thinking, feeling, and doing as they do. So person-centered therapy views that people are doing their best, that they can heal in the right environment. And so this unconditional positive regard we have for them, that we value them as a person regardless of what behaviors they have, that they're trying to do their best. And that makes them, again, feel valued and understood, which is really important to build the relationship. Congruence. So being genuine towards yourself and your client, you should be your true self in the room. And this involves being honest. If we're genuine in the therapy room, then it also helps our client to be genuine, to be their true self. We're trying to help them understand themselves, their true feelings, what they want. And so us being able to express ourselves genuinely helps them to express themselves genuinely. We don't want our client to think that we're putting on this act of being this expert therapist that knows best, because we don't know what their world is like. And we can only understand them through offering these core conditions. So these are very important, and you need to start thinking about these now. They're seen as the foundations to start building that relationship with our client. And the client needs to be able to feel these things from us. So just some things to consider here. Why do I want to help? Why do I want to be a therapist? And bear in mind that not all reasons are positive. As therapists, we can have a lot of power and control over our clients, but that's not how it should be. Do we need to boost our own self-esteem in some way by doing this role? So it's important to really think about why you want to help. And what does helping a person mean? As I said earlier, it's important that we don't advise our clients, don't tell them how we would deal with it. We're not trying to fix them. So helping doesn't mean that we're trying to make them feel better, giving them solutions. It means that we're on their journey with them, a journey of self-awareness and understanding. We need to consider our current level of competency. As I said earlier, it's really important to only ever work within our levels of competency. It's thinking about how to create a suitable environment. You don't need to be even thinking at this stage about seeing volunteers, but at some stage you will be. And so it's being able to think about where you would work with that volunteer, where would be a suitable environment, and how would you assess who would be a suitable volunteer. And that's something that will be discussed as you go further into the course, how to find suitable volunteers. And also considering how to develop my skills. So after every module, you will have homework and you'll be doing practice. But it's trying to also think about how else you can develop your skills. Sometimes watching videos, watching TV programs, reading books, all that will help you to develop your skills. And also your self-awareness. Self-awareness exercises are really important because you need to be self-aware to be able to help others. You also need to consider if you've got time. It's time management is really important. You need to make time for suitable practice because without the practice, you won't be able to develop your skills. And also ensuring that you don't let personal issues affect therapy. If you've got something that comes up for you, a bereavement, illness, it's important to look after yourself and be aware that at those times you might not be in a good place to be able to help others. And it's also being able to identify if you need to go into personal therapy yourself. And the Johari window is really useful for your own self-awareness, but this can also be useful for working with volunteers and clients. And it's about basically these 4 areas. And these are things that we would say the open parts of ourselves. So these are things that we know about ourselves and other people know as well. So things that other people can see and that we're willing to disclose to other people. And then there's the hidden parts. So these are things that are known to us, but are not known to others. So they're the things that we may want to keep private. We don't want others to know about them. We want to keep them private, confidential. There's also the blind spot. And this is things that are known to others, but not known to us. And this might be little habits that we do unconsciously. And so other people can see these behaviours, but we can't actually always be aware of them ourselves. And in therapy, it's important to try to recognise some of these things that we might be a bit blind to. You know, we may sit there, maybe swinging a leg. That might be one of the little habits that we do, but maybe that's really distracting to a client. So it's becoming aware of those things. And of course, there's the things that are not known to us and not known to others. These are things that are deep in our unconscious mind. And so this exercise will be talked about more in your class discussions. Let's just now look at the core counselling skills then, because these again are something you will start doing from this point forward and continue throughout the course. These are the core skills that really, again, help us to build that relationship with our clients. We need to be actively listening. And that's not just listening, but not really listening. It's listening intently. We're keeping eye contact. We're noticing body language, tone of voice. We're also noticing what they're not saying. And we're not interrupting. We're not rehearsing what we want to say. We're not thinking about what we're going to cook for dinner. Our full attention is on the client. We're picking up as much as we possibly can from everything they're saying and doing. Paraphrasing. So paraphrasing involves summarizing in a few words what the client is saying. And we may use some of the client's words, but we don't want to sound like a parrot. So we're repeating back, but not exactly as the client said it. And when we paraphrase, when we say back what we've heard, it can help the client to recognize what they've said and also expand on it. So when we paraphrase, often the client gives us further information. So it's a way of getting information without asking a question. Because if we ask too many questions, it can feel like an unequal relationship, like the therapist has got all the power. Summarizing. And so that's often used to summarize a section of a session or at the end of the session. And it lets the client know that you've been listening. So we will often get clients and volunteers that talk a lot. They want to offload, and they might give an awful lot of information. And sometimes it's really good to just sum up what we've heard so far to make sure that we've understood it correctly. And that can be really useful. And we always use summing up at the end of the session. So it's important to make sure that we're prompt at ending the session. We shouldn't be running over. We need to keep those boundaries. And so stopping a few minutes before and summing up what's been said in the session shows the client that you've really been listening and trying to understand them. Clarifying. Clarifying shows the client that you're listening and trying to understand as well. And the client might unmuddle themselves as you ask for clarification. So you might say, can I just clarify? And that sort of helps the client to see that, oh yeah, they're really trying to understand me. Because sometimes something a client says might not be totally clear, and you do need to clarify it. And reflecting. So here the therapist uses the client's narrative without adding anything new. And it can be to emphasize an aspect so the client themselves can hear it. And this is really useful to help them become more self-aware and understand what they're really experiencing, and helps them identify with their own feelings. So you could just pick up on a part of something a client says, or even just a word, a very strong word that they use. You can say it back to them, and it brings it to their awareness. And again, it can also make them then give more information, which is useful to you. So these are the core counselling skills that we're going to be starting to use with our clients, and they do take practice. Often students, when they're working with their peers, when you start doing role play exercises, you want to ask questions. And it's really important to try and, rather than ask a question, to paraphrase, because you can get further information from the client by doing that. It's also difficult to listen actively, especially when you first start with role plays with your peers, because you're thinking about what you should be doing. And that can be distracting you from really listening to them and observing their body language. So these things take a lot of practice. And so that's why you need to start practicing them from the very beginning. So a lot of information to take in on your first module. As I said at the beginning, make sure you make a note of anything that you want to take to class so that you can have more clarification from your class tutor. But for me, that's it for now. Thank you for listening to this lecture, and I will probably see you again soon. So bye for now. Let me stop sharing.